The inborn errors of metabolism. Most of these conditions are actually tested more linked to the chemistry portion, as it tends to have to do with more of the chemistry type stuff. But because obviously the chemistry and pathology portions are smushed together, the second portion of the exam expect to have at least a couple of questions from the errors of metabolism, because it can come from the two different sources of material. So, and also in this, I have a lot more in here than what's typically asked. I'll point out the most important ones. Alkaptonuria. This is a rare metabolic disorder. We get what is called homogentistic acid, or HGA buildup. This is one of the intermediates from the breakdown of phenylalanine and tyrosine. We remember with phenylalanine and tyrosine, this is where we get a bunch of our catecholamines, epinephrine, norepinephrine, dopamine goes into L-DOPA, all of that stuff. So it's super, super important that we're able to break this stuff down. So if we're unable to, that is definitely a big problem. The key feature to know about this is that the patient will have a dark black urine as soon as the urine is exposed to air. Also, this is an autosomal recessive gene. This is another thing that will pop up on questions. This usually gives you a little bit of a hint when they ask the questions. They'll say, which of the following autosomal recessive conditions, blah, 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 blah. Or which of the following is an autosomal recessive condition, blah, 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 blah. And so if you know which ones are recessive versus dominant, that is a big help. You can take a look at these ones, not very heavily tested ever, so I'm not going to stress about them in this chunk right now. Just again, look, autosomal recessive versus X-linked recessive. Those are the things I would associate the name with what they are, if they're recessive or if they're autosomal or if they're X-linked. Homocystinuria. This is affecting methionine metabolism. If you've already watched the biochemistry portion, we talk about the methionine homocysteine cycle and the importance of the B6, B12, B9 vitamins that are all associated with all of those. So we 100% want to remember those guys. B6, B12, folate is B9. Remember those guys as they pop up quite a bit. With homocystinuria, we can have marfanoid features. So similarities to Marfan's syndrome, which is another condition we'll talk about a little bit down the road. But biggest thing is this type of question, you're going to have some question talking about either the vitamins themselves, talking about methionine, talking about homocysteine in like a lab or something like that, and that's when you suspect this condition. Maple syrup urine disease. This is a condition where we don't have the enzyme to break down branched chain amino acids. Remember, if you watch the biochemistry portion, and this is why I said they're very closely linked, this whole chunk, we say live on a branch, LIV. Leucine, isoleucine, and valine are our branched chain amino acids. Body can't break them down. As a result, they end up getting excreted in the urine, and you get a sweet smelling urine. Kind of it supposedly smells like maple syrup. Only treatment for it is actually just restricting those specific amino acids. McArdle disease, very, very uncommonly talked about. It's a glycogen storage disorder, and it's autosomal recessive. Phenylketonuria. They love to ask questions about phenylketonuria, PKU. This is a deficiency of phenylalanine hydroxylase, which leads to toxic phenylalanine accumulation. and this is the treatment for this, is restricting the phenylalanine diet. This is actually something that they test for now in babies. When they do the initial blood draw, heel prick test to check to see if anything's going on. This is one of the conditions that they actually screen for, as it's important to catch early, as it's 100% treated by diet. Pompe disease, another glycogen storage disorder, autosomal recessive. You kind of start to see a pattern. The vast majority of conditions are autosomal recessive. So if you're going to take a stab in the dark, we want to guess autosomal recessive. Tay-Sachs disease. This is a lysosomal storage disease. Here we get a cherry red macula, so the back of the eye. Those are the only things that they really ask you about Tay-Sachs disease. It would mention something like, upon eye exam, you see a cherry red macula. Von Gierke disease. This one is the one of, as far as the glycogen storage disorders go, this is the one that they like to test on. It is a glucose 6 phosphatase deficiency. Glucose 6 phosphatase is responsible for helping in the liver to release glucose back into the blood. So if we can't release the glucose back into the blood, it all just gets trapped in the liver. We end up with hypoglycemia, as well as hepatomegaly, because we end up storing just a bunch of glucose and stuff in there. It can get converted to fat, and then it ends up having problems. So kept this one nice and short. The next video is going to be a little bit longer. We talk about congenital disorders. Congenital disorders tends to be a little bit more tested on Part 1 boards than some of those other conditions, as well as it pops up a lot in the spinal anatomy section with a couple of these different conditions. And we'll see that in the next one.